and welcome to the Savvy Safety Sisters Partner in Prevention podcast. I'm your host, Carrie Pasquarello of Global Secure Resources, and we know one of the best ways to make a difference in preventing harm and victimization is to bring stories from around the world in hopes of bringing awareness to help keep you and your family safe. We want to empower our listeners with education and advocacy by experts and individuals and their stories. Now, losing a child is an experience no parent should ever have to endure. It's a pain that cuts deep, leaving an indelible mark on the hearts and souls. It's a journey through darkness, navigating waves of grief that threaten to overwhelm at every turn. Yet in the midst of this profound sorrow, there's a mom who is a testament to the enduring power of love. A love that keeps memories alive and a love that refuses to be extinguished, even in the face of unimaginable loss. And that leads me to my next guest, Sandra Bagwell of Texas. She's the mom of Ryan. Now, Ryan lost his life to an accidental poisoning, and Sandra is bravely sharing her family's story to shine a light on the dangers of how one pill can kill. Thank you so much for joining us today to share a little bit about your journey, Sandra.
Thank you very much, Carrie, for having me. I appreciate it.
Absolutely. I think we could start with if you could share a little bit about your son and the impact that he's had on your life.
My son Ryan was born on, he was a Christmas Eve baby. He was born on December 24th, 2002. And always, since the day he was born, he was nonstop. That little boy was so full of life and just an amazing kid. Had so many friends, loved by so many. And he unfortunately lost his life to fentanyl poisoning at the age of 19 on April the 4th of 2022. So this coming week will be 2 years that he's been gone. And just knowing, for me, and I speak to a lot of grieving moms, and it's kind of like a blur. To us, it seems like it's been, 2 months ago or 6 months ago. It's, we go by day, yes, because we have to. But it's been so very difficult. But amidst of this tragedy, I turned my sorrow into a passion of educating others. And I've become a huge advocate for fentanyl awareness in my state of Texas.
Oh, thank you so much for sharing. And it's just so painful to hear this, but we are so sorry for the loss of your son. Now, how did you discover that your son had been exposed to this poisoning by fentanyl?
So the day before he died on April the 4th, right? And him and a friend went on April the 3rd. It was a Sunday. And we live right across in Texas, the border. So they walked across to Mexico. It's called Progreso. And he was 19 years old. Did we want him to go? He didn't hide it from us, but he went, and they were just going to go eat and maybe have some drinks or whatever. And he purchased pills in a pharmacy there in Progreso, Mexico. He thought he was purchasing Percocet. He bought a bottle of 10. Came home that night in a great mood. Little did I know, of course, he didn't share that he had purchased medication. And he took that pill. That's all it took. One pill that he took that evening, and we're not sure. They couldn't tell us exactly what time, he died, but I was the unfortunate one to find him the next morning about 10 o'clock.
Tragic.
yeah, and it's just a nightmare,
You know,
finding your own child. I guess I'm lucky that he was at home. A lot of these cases are, kids are, left to die alone in someone's yard or, in other places, and that breaks my heart. Um,
and with the pills that he had purchased, did you send them over to a lab and were they tested out to see exactly what was included? Was there any Percocet
yes,
in
and
the pill?
so like I'm sorry I didn't include that, but like when I found him that morning, I knew I was like, he was in Mexico yesterday. He must have bought something. A mom knows.
Yeah,
Like he was a healthy kid. Yes, he had, gone to the doctor a few days prior because he had like a sinus infection, but I knew, I mean, that's just a sinus infection. So they tested him for COVID and all these other things. But I just knew in my heart that it had to have been something that he got in Mexico.
yeah.
And so sure enough, when toxicology came back, it showed that he had fentanyl in his system, 11 NGs, which is 5 times the lethal limit. 2 NGs is lethal. And so after that, I went into his room, I searched. I knew there had to be some evidence in there that the police didn't find. And sure enough, I guess they really didn't look, I don't know. Um, but I found the bottle of Percocet, turned it into DEA. DEA in turn tested it, and a couple of months later, the agent called me back and said, Ms. Bagwell, those pills that he had were no, it didn't have any Percocet whatsoever. They were complete fentanyl with like a tiny coating of aspirin.
Oh, lethal quantities of fentanyl in these pills. One of the areas that I focus on is training students before they do study abroad or any type of travel. And that's one of the areas that we cover is the tainted medicines that students do purchase while they're on trips around this world, especially in Mexico. And students might think they're just picking up Adderall or some other type of medicine like your son, and then
Right.
yet it has lethal quantities of fentanyl within these pills. Um, Now, can you share with us the term, and I think this is so important to cover, the term used, poisoning versus overdose, so that our audience can better understand, because I know these two terms are used often, and I would love for the audience to hear from you about these two terms.
Yes. As we all know, overdose means you take too much of one thing. It could be you overdose on a whole bottle of Tylenol. You take too much of it, right? A poisoning is when you take something, say you took a Tylenol and you didn't know that that Tylenol was tainted with um, fentanyl. And so when you take something thinking it's something else, then that's a poisoning because that individual did not know that they were taking fentanyl. So that's the difference between a poisoning and an overdose. Yes, of course, there might be some medical doctors out there that'll say it's still an overdose. Yes, I understand where they're coming from when they say it is an overdose. Of course, it is an overdose. It was too much fentanyl, right? And that killed him. But when the person doesn't know that that's what they're taking, then that's when it becomes a poisoning.
Absolutely. And I've heard that you've had some success in Texas on, let's say, the death certificates, how they're presenting that it is a poisoning versus
Yes.
overdose.
Yes.
That's happened in Texas, and I think some other some legislation in other states are going through as well to change that, because it's important to understand and be able to share that this was a poisoning, and our youth are out there and they're taking pills and thinking it's something and thinking that they're taking a prescription that one pill would be okay, when in reality, one pill can kill, and this is a definite poisonings. Um,
Right.
so I'm so happy that you could share that with our group.
Yes. And to make it clear also, Carrie, I wanted to mention, yes, we're doing the in Texas, and DEA also has that, the one pill can kill. And uh in Texas, the Governor Abbott has a one pill kills campaign. Yes, we stress a lot of these cases are deaths by taking a lethal amount of fentanyl in a pill, right? But fentanyl can be in other drugs, cocaine, it can be in any other drug. So it's not just in pills. So people need to be aware of that as well. That just, oh, okay, well, I'm not taking a pill, so I'm safe.
Right.
Thing is safe. Um,
Sure.
Nowadays it's even in weed. There's been deaths where, there's fentanyl in the weed.
Right, or
Also,
heroin, or
or heroin,
cocaine.
exactly.
Exactly, so any type of a drug that people are taking nowadays, it could be incorporated in. And so that's really important. We don't know, where fentanyl is being hidden, and yet in poisoning our children, or
Mhm.
our young adults, or our older adults, anybody, really. So
Yes.
what are some, facts that you've learned about fentanyl over these past
Um,
few years that you'd like
well,
to share with the
right,
group?
right. Well, fentanyl is 100 times stronger than morphine and 50 times more potent and stronger than heroin. I mean, just that in itself tells you how extremely powerful this drug is. Um, so I know I had shared with you yesterday that this new statistic just like is an eye-opening, that 25 high school students every week die from illicit fentanyl poisoning.
25.
So 25
25 students are lost in the United States each week.
students, yes, to fentanyl poisoning. And to compare it to, that's an Uvalde shooting every week. 25 kids dying
Right.
every single week. There's other statistics that also every 11 minutes, and some have shortened it to 5 minutes, that someone in the United States is dying from fentanyl poisoning. So it's just very sad,
Yeah, and I know that
that all these deaths are happening, and no one's really talking about it. I mean, you know,
sure,
parents need to be aware. I
they do,
mean,
they do.
not just parents, the youth, everyone needs to know what's going on, and they
Right.
need to be educated.
Yeah, and DEA is doing a great job out there trying to confiscate and seize these drugs off the street. And I know back in 2023, they seized more than 78 million fake pills on our streets, and more are just pouring in over the border, and people are going down and picking them up themselves. So that's a lot of drugs on our street, and this is exactly why we need to shine a spotlight on this issue to give people the opportunity to see how dangerous this is, and this is something that we really need to have more people involved with. Now, what are some of the immediate challenges that you faced after his accidental his poisoning?
I know that I've a lot of judgment, and of course, I'm not the only one. Whenever a loved one dies of, you know, anything dealing with drugs, people assume, oh, well, he was an addict, or you were a bad parent. Um, why did you let him go to Mexico? Or how could you not know? Those type of things that I knew I was being judged. But I felt I really don't care. I need to bring this awareness. And whether you want to listen or not listen, I want to save lives. And that's my purpose. But that's the biggest thing that I feel, we all feel it. My husband felt it and wasn't comfortable with me doing my advocacy because he felt, like Ryan was the poster child for fentanyl poisoning. And I'm like, no, he's not. He's bringing awareness. Ryan had a huge heart, and Ryan would want me to do what I'm doing,
Yeah.
you know, to warn others, to save lives. So I think that's the biggest hurdle or just the
Challenge.
judgment that we have to go through as parents, as well as not having enough support from our local police department.
Yeah.
That's another thing that's a big problem.
And it
Not
seems,
just here, it's
right.
everywhere.
And it seems that every single person I talk with knows somebody.
Mhm.
This is really affecting every single family in America somehow, some way. So,
Yes.
what are some signs or symptoms that you'd want to share with other parents so that they can recognize these issues and perhaps prevent their children from having a fatal poisoning of fentanyl?
Right. I would just advise all parents to educate, children do listen. They do. Even though we think sometimes they're not listening, but they do. Educate your children about the dangers of fentanyl and how it can be in anything. And some signs may be, I mean, you may not know. I mean, this could be like my son. I believe it was, he was experimenting.
Yeah,
And it's happening a lot where you don't see any signs because it just, from one day to the next, it happened. And it's very sad that when we were young, we could experiment, you know, and we knew that it was okay. We weren't going to die. Now we don't have that option anymore. It's like playing Russian roulette. If you're going to do drugs, then, just know the facts. Parents, I do advise them to get Narcan. It's a nasal spray that reverses the effects of fentanyl poisoning. So I know it's available here in Texas. I'm not sure in other states,
yeah,
but I mean, it can save a life.
right.
So if you suspect maybe erratic behavior, irritability, and I know sometimes you may, think, oh, well, that's a normal teenager. But if they're experiencing depression
Yeah.
or anything like that, then you need to be mindful and be careful um, with your child because you never know. Their friends can say, "Oh, I have something that'll help you ease take the edge off or whatever," and it's
Right. Well, that's some great
scary.
advice with the Narcan and really just keeping your eyes open and watching your children, looking for changes, and
Mhm.
really just having those deep conversations with your family together on this
Right.
topic.
Right. And that
Could you,
Narcan is readily available
yeah,
now. That it should be something that's kept in your medicine cabinet, just like Tylenol and aspirin, and you know, um, and it's very sad that a box of Narcan comes with 2 doses, and there's been cases where they've had to use like 6 or 7 to revive someone. That's how extremely potent fentanyl is. So I would advise to have more than one
right.
box of
Yeah,
Narcan.
that's a
Mhm.
great piece of advice. And could you tell us about any initiatives or organizations that you've become involved with to raise awareness about fentanyl and its dangers?
I'm currently the vice president of a coalition to end fentanyl poisoning and opioid overdose. Um, so it's a small organization that we've started, and we've been slow to start, but there are so many great organizations and mom groups that I'm part of. One of them is Texas Against Fentanyl. And the leader and the president is Stephanie Turner, and she has made so many changes. She developed a curriculum, um, and a law was passed under her son's name called Tucker's Law, and that that did pass here in Texas, and so there will be education for middle school students up to high school, because of Tucker's Law and Stephanie Turner.
Oh, that's really wonderful
And,
news.
and I am involved in others. I have Souls for Souls. I have a Change for Cam. And I do wear their bracelets here on a daily. And the kids always ask me, I'm a teacher. So they ask me, why do you wear those? I'm like, because those are my mom, and I just, you know, I love them, and we just support each other, lift each other up, and we understand. We share the same pain.
Sure. So that kind of brings me to my next question is what support systems or resources have been helpful to you and your family going through this tragedy?
It's been really rough. There really isn't a whole lot out there. I had to go searching myself. Our mental health system here in Texas is not good. So we, have to go out on our own and search. But like I said, those mom groups have been like they've been my angels. They've been my support, and we get each other. If it wasn't for them, I wouldn't be here. There's another group that I first started with, and it's Lost Voices of Fentanyl. I don't know if you've heard of them. The leader is April Babcock. And, I would just see how these women were out there advocating, and that brought me like strength, like maybe I could do this. And it's not for everybody, but I feel that Ryan and God have given me a purpose, and that's why I'm here.
And so I know you've kind of touched on, you've encountered a little bit of the misconception and the stigma surrounding the accidental poisoning deaths. How do you bring up this conversation with others about the overdose versus the poisoning? And I mean, a really quick way of expressing yourself in a situation of misconception. How do you deal with that?
Um, it's tough at times. I mean, the majority of people, and I guess because they're my friends, they're not going to argue with me, but they do agree with me. I mean, it is a poisoning. And I recently was on an article in the New York Times, and it was specifically on overdose versus poisoning. And a lot of the comments came back, um, some negative, and it's heartbreaking. But, everyone is allowed their own opinion. And, you know,
And
medical
unfortunately,
terms, yeah.
right. And unfortunately, when we're looking at losing over 100,000 people each year to these poisonings and drug overdoses and death because of drugs, people, like I mentioned, are experiencing having a friend loss. And I think once you have it closer to home, people are starting to realize it is a poisoning and it is something that we need to talk about and have more compassion and empathy for our family members that we're losing to this war on this poisoning, right? And this fentanyl that's coming
It's an
into our
epidemic.
country.
It really is. It's an epidemic.
It really is. So with that, do you have anything that you'd like to share with our audience as we end our podcast for the day? Any last words?
Um, I just want you all to remember my son, and that's the reason that I do that. And I'm here to, I guess, I stand for all my moms, all my families, that angel families that have lost loved ones. Um, we're struggling, and we're really struggling each and every day. And but we're not giving up. We're here because we want to save lives, and so glad that we have the health and the strength to be doing it. And I'm proud of all my angel families and moms, that I love them
God
dearly.
God
And
bless them.
yeah,
Well, thank you
because
so much.
there's thousands of Ryans out there each and every
Yes.
day that are dying.
Yes, absolutely. And I just want to say thank you so much for your courage, for coming on our podcast and sharing with the other families around this country um, ways to help improve um, their health and safety, really. And that's what it comes all down in the name of Ryan. So thank you for being so courageous and sharing your story. I know it's a difficult path that you're on. And I guess I'll end with our best advice to parents is to have a conversation with your children. The worst mistake that you can make with your children as a parent is saying that it can't happen to my child.
Exactly.
Because this is not just affecting people with substance abuse disorders, it's affecting our first-time experimenters, our children that are trying drugs for the first time or thinking they're just taking one pill that is safe. And so you need to have that talk with your children, whether you think that they're going to use or not, because it could be something as simple as getting Adderall over in Mexico or borrowing Adderall from a friend because they want to take a test or study harder.
Mhm.
And if it wasn't prescribed to you and you didn't pick it up from your pharmacy, you can't know what's in that pill. And one pill can kill. So please spread the word and talk with your family and friends about the dangers that are out there with fentanyl. And that's it for today. We'll be back for another episode to increase public awareness and to reduce the dangers faced by citizens in their daily life, whether traveling around the corner or the world. And please visit us at Global Secure Student for more information about our community awareness and prevention programs. Thank you once again.
Thank you.